Hey everyone, and welcome to This Explainer. I'm so glad you're here. I'm representing the incredibly passionate team over at Next Level Speech and Physiotherapy Center, located right here in Dubai. For over 11 years now, our clinic has had the absolute privilege of helping more than 7,000 children and their families navigate what is often a beautiful, but let's be honest, sometimes really complex journey of developmental support. So today, we're going to talk about autism, social communication, and really just mapping out your child's path forward.
Now, getting an autism diagnosis, it brings an absolute whirlwind of emotions. The questions usually hit almost immediately, right? What comes next? Who can help? What kind of support actually makes a real difference? Some parents tell us they feel a huge sense of relief finally having an explanation, while others feel grief or just overwhelming anxiety. And look, we see this every single day in our clinic. I want you to know that whatever you are feeling right now is completely valid. Our clinical team is here to be your trusted, compassionate guide to the whole shebang.
Okay, let's dive right into this. Section 1. Understanding social communication.
So at the very center of autism for most families is communication. But the thing is, it doesn't look the same in every child. We see incredible diversity in our therapy rooms every single day. Here's a core piece of our clinical philosophy. There is a really distinct difference between fluent speech, which is basically your child's vocabulary, sentence structure, and articulation, and social communication. Social communication is a whole different ballgame. It's about eye contact, reading the room, taking turns, or understanding non-literal phrases, like when we say, "It's raining cats and dogs." In our clinical experience, a child might have perfectly fluent speech, like a massive vocabulary, yet still deeply struggle with the social use of language.
Which actually brings us to a question we hear from parents almost every single week. They ask, "My child has autism and speaks well. Do they still need speech therapy?" Well, the short answer is quite possibly yes, because fluent speech and effective social communication, they're simply not the same thing. Getting a comprehensive social communication assessment is absolutely crucial here. We want to help your child navigate those tricky, unspoken conversational rules, learn to read between the lines, and really develop that flexible thinking you need for group interactions.
Now, this fundamentally shifts our perspective on something really important. Scripting, or echolalia, is a totally valid form of communication. So many parents come to us, worried because their child frequently repeats lines from TV shows or movies. At Next Level, we do not view this as a deficit. It's not a bad behavior that needs to be stamped out. Actually, it's often a child's way of initiating interaction, or maybe managing anxiety. We view it as a starting point. We assess the communicative intent behind it, and then we work to build more flexible language right alongside it. It's really a game changer when you look at it that way.
Moving on to Section 2. Signs you need an assessment.
Let's talk about when it actually might be time to reach out to our team, even if you don't have an official autism diagnosis yet. Here's a helpful checklist of signs we frequently look for during initial evaluations at our JBR clinic. Things like limited eye contact, not consistently responding to their name, or delayed language. You might also notice highly literal language, difficulty taking turns, or maybe your child really struggles in group settings despite having plenty of spoken words. Now, I want to reassure you, seeing these signs does not automatically confirm autism. Not at all. However, they are really important indicators that a targeted speech and language assessment could be incredibly helpful for your little one. If you're noticing these, it's definitely worth taking them seriously.
All right, Section 3. Empowering Voices with AAC.
This right here is an area where parents often feel the most anxiety and confusion when they first come to see us. So let's unpack it together and shed some light on how we handle this therapeutically. AAC stands for Augmentative and Alternative Communication. Simply put, it's just any tool or strategy that supports or replaces spoken language. This can range from simple, low-tech picture boards to super sophisticated, high-tech speech-generating apps on an iPad. But what's absolutely crucial to understand about our center's approach is that we never, ever just prescribe a one-size-fits-all gadget. We meticulously tailor the AAC tool to your child's specific cognitive profile, their motor abilities, and honestly, what is realistically sustainable for your family to use at home.
So the crucial point is this. The research is incredibly clear. AAC does not reduce spoken language development. Let me repeat that because it's huge. It does not reduce speech. This is easily the biggest myth we encounter in pediatric speech therapy. As a clinic, we proudly stand on the evidence that giving a child an alternative way to communicate doesn't stop speech, it actively supports it. By providing a reliable communication method, we're basically freeing up the child's cognitive space. They don't have to work so impossibly hard just to be understood, which gives natural speech a much better environment to develop.
Another huge concern we hear is, well, should we wait until our child is older before trying AAC? Let me be very clear on behalf of our entire clinical team. We confidently debunk this outdated advice. Waiting simply does not serve your child. There is absolutely zero minimum age or language prerequisite required to start AAC, none. If your child can benefit from an alternative way to communicate right now, we believe in providing that support right now.
And the beautiful result of stepping in early is pretty simple. Better communication equals reduced frustration, which equals fewer meltdowns. In our 11+ years of hands-on experience, we consistently find that a massive percentage of meltdowns are driven by communication frustration. I mean, imagine not being able to express a basic need. It's incredibly frustrating. By giving your child a reliable way to communicate, we directly remove that massive driver of frustration. And that naturally, wonderfully, leads to a more peaceful day-to-day life for the whole family.
Okay, Section 4, our individualized therapy approach. So what actually happens once you walk through the doors of Next Level Speech and Physiotherapy Center? Well, we follow a highly individualized 3-step methodology. Step 1, we use standardized assessments, but we always pair them with naturalistic observation. Step 2, we engage in play-based, individualized therapy. You know, we learn so much from how a child plays. We aren't just checking off rigid developmental milestones on a clipboard. We're looking at the full, beautiful picture of your child. And Step 3, deep family involvement. Therapy shouldn't just happen once a week in our clinic. We train you, the parents, so these communication strategies actually come to life at home.
Now, even with great therapy, parents often ask us this really fearful question. My child was making progress and then seemed to regress. What does that mean? I want to gently reassure you right here. Regression can happen for so many totally normal reasons. An illness, a sudden change in environment, a spike in anxiety, or just the natural, kind of uneven way neurodevelopmental progress works. Our team is here to assess the situation and lovingly adjust the therapy plan. We don't panic, and you don't need to panic either. We simply pivot and support you through it. Which brings us to Section 5, your child's path forward. Let's talk about how we integrate our support into your child's broader world. 7,000. That is how many children have been supported by our clinical methods over the years. To put that into perspective, that is a whole lot of families who were once sitting exactly where you are right now. When you join the Next Level family, you're stepping into a community backed by immense clinical experience and deep compassion. We want you to look at that number and know without a shadow of a doubt that you are never, ever alone on this journey. We are also right in your neighborhood. We're centrally based in JBR, but we serve families all across Dubai Marina, JLT, Palm Jumeirah, Bluewaters Island, and the Greens. We've purposely structured our clinic's footprint so that world-class, premier rehabilitation support is easily accessible to you right where you live. No crazy commutes required.
Finally, we strongly believe in what we like to call the village approach. Because let's face it, a child's life doesn't just happen in a therapy room. That's why we collaborate deeply with schools, occupational therapists, psychologists, and of course, your family. We actively integrate with inclusion programs and learning support teams all across Dubai to ensure your child experiences consistency everywhere they go. When everyone is on the exact same page, that's when a child truly thrives.
So, I want to leave you with a thought-provoking question to ponder today. What goals matter most to your family? And how can we help you reach them today? Whether you're ready to book an assessment right now or you just want to have a preliminary, no-pressure conversation to ease your mind, we warmly invite you to reach out to us via WhatsApp or just come visit us in JBR. Your child has a beautiful path forward, and we would be absolutely honored to walk it with you.